are called to serve humanity, endowed with the art and science of caring. We are built on integrity.
Good morning, my beautiful people. It's your dynamic nurse. It's been like a year now that I've not posted a video, and it's for a good cause. That long holiday actually brought a bouncing baby boy. All glory to God. I appreciate my fans, I appreciate my friends, my family who has been around me. So today I'm going to be discussing an issue that has really eaten deep into nursing profession. Nursing is a noble profession, and everyone wants to be identified as a nurse. But if you don't go through the right channels, you can't call yourself a nurse. You are either a nurse or you are a quack. We don't have anything called auxiliary nurse. So today, it has eaten deep into my profession, into nursing, that it pains me so much. Quackery is in other profession, but I'm sure it's higher in nursing. So my topic today will be how quackery has eaten deep into nursing profession. But before I go into that, let's see who a nurse is. Who is a nurse? A professional nurse is that person that have gone through the 3 years course in the School of Nursing, or have acquired a BNSC, which is 5 years in a university, and is registered with the Nursing and Midwifery Council and licensed to practice. If not, the person is not a nurse. Then we hear of auxiliary nurses. There is nothing like an auxiliary nurse. An auxiliary nurse, so to say, in quotes, is a quack. And what is quack, or who is an auxiliary nurse, or who is a quack? These are the people that go through training, either in a hospital setting, trained by not unprofessionals, trained by other people. They don't go through the school and they are not licensed to practice. And when you see them, you know them. You see the way they dress shabbily, see the way they talk. When you see a professional nurse attending to you, you know them. The next time you go to a hospital, ask that nurse, are you a registered nurse? I'm sure registered nurses will not be angry to answer that. While quackery is dangerous, it has killed so many lives, and so many other lives will continue to be in danger if nothing is done about quackery. And funny enough, some hospitals, if I may say, prefer to hire a quack, auxiliary in quotes, a quack nurse, rather than hiring a professional and qualified registered nurse. Reasons being, maybe they can't pay the professional nurse. They take these quack nurses, auxiliary in quotes, because anything they offer to them, they take it. Regardless of the jobless situation in our country, nurses in other countries are regarded as gods, as angels, and treated with respect, and they are also highly paid. But that is not the case in some of the African countries, especially in Nigeria. That is why quackery is thriving so much. Instead of a private hospital owner to hire a qualified nurse, prefers to train these quacks auxiliary nurses, in quote, train them and hire them as, use them as nurses. They also use them as cleaners, use them as receptionists. A nurse is not a receptionist. A nurse is not a cleaner. We have different specialties in nursing. We have psychiatric nurses. We have O&G nurses that work in labor ward. That we have the midwives. We have the orthopedic nurses. We have the ICU nurses. We have so many specialties that nurses specialize in, and they are very good at whatever they do. I'm sure you've met nurses, professional nurses carrying out their duties. They are good at what they do. I am saying it, not missing a word. But quackery has come to spoil the nursing profession. It has spoiled the name of this profession. And it pains me so much because I know what it took me to become a nurse, and other nurses out there. We know what we've gone through to become a professional and licensed nurse. If you went through school of nursing, or you went through the 5 years in a university, you will know what I'm talking about. A nurse should be respected. A nurse is a professional in all ways. Nurses can do so many things beyond your imagination. But quackery has spoiled the name of nursing profession. You see them everywhere you go because they are being employed. I will show you some pictures showing some quack nurses that call themselves auxiliary nurses. I don't know where they got that name from. And most of this other profession that is training these people and giving them certificates and calling them auxiliary nurses. Have you ever gone to any private hospital where you see auxiliary doctor? I'm sure the answer is no. Have you ever gone to any place you see auxiliary pharmacy? No. It is high time we stand up and fight against quackery in nursing. I hate it, and I will do whatever it takes to stop quackery in nursing. And I also encourage the Nursing and Midwifery Council to please look into the rates of quackery, and the schools that train quacks, the hospitals that train quacks, they should be brought down. And also, the government should also help the nursing profession by putting a rule or a constitution that will guide against quackery, so that they will know it has become a serious case. And quacks, they should be arrested also, because it's a criminal offense. Please, when you see professional nurses, you know them. And I am proud to be called a nurse. I am proud to be called a nurse anywhere, anytime, any day. Please help us also to identify one and help us stop. Raise your voice also and stop quackery in nursing profession. Thank you very much.